RCSI is an independent, not-for-profit university, and our mission is to educate, nurture and discover for the benefit of human health. Established in 1784, RCSI was founded as the national provider of surgical training in Ireland. In the years since then, RCSI evolved to become recognized as one of the world's leading health sciences universities.
I chose to study in RCSI because I like that it's a healthcare focused school. I've always known I wanted to study in healthcare, so the facilities here, they're like one of the best in the country. We get trusted to see patients from year one. That's an incredible opportunity that we can't get anywhere else.
RCSI's Bachelor of Dental Surgery or BDS program offers a distinctive quality educational experience at a world-leading health sciences university to be trained as a dentist. Our students enjoy an immersive educational journey with a strong focus on acquiring the clinical and professional skills necessary to practice dentistry in complex healthcare environments and to serve the oral health needs of diverse populations and cultures.
The BDS at RCSI is a 5-year, full-time undergraduate degree program designed for those who want to study dentistry in a dynamic, clinically focused environment. As one of Ireland's leading dentistry courses and the first community-based dentistry programme in Ireland, the Royal College of Surgeons in Ireland's BDS combines cutting-edge facilities, early patient contact and expert teaching to prepare students for a successful career in dentistry.
Obviously, as a dentist, we'll need to have really good clinical skills, and to develop that from year one is a great opportunity for the students to be exposed to patients and to learn from an early stage how to deal with patient communication as well as just doing the clinical work.
Students complete their clinical teaching and learning in RCSI's modern, purpose-built dental education centres in Dublin. These facilities are designed specifically to meet the learning needs of students, allowing them to have early hands-on training in clinical dentistry in a primary care community setting from an experienced and supportive faculty. Our head and neck anatomy programme is integrated with RCSI's other undergraduate programmes, with practical teaching taking place in our traditional anatomy room situated on St Stephen's Green campus.
I think a huge benefit of having an anatomy lab and seeing so many cadavers is you see it on the lecture slides and you hear it in lecture, but there's a huge difference between seeing the 3D arrangement of how things work together. It was really amazing to get that experience to be in the anatomy lab, just to really get a more three-dimensional understanding of how the body and all its systems work with each other.
The RCSI Simulated Dental Learning Environment, or SIDL as it's known, is equipped with a comprehensive and extensive range of models and state-of-the-art patient simulators, which enable students to develop and consolidate their clinical skills before starting to treat patients.
Everything is brand new and state-of-the-art. We have all our own personal equipment, like our own instruments. We all have our own personal phantom head in the simulation lab. We also have loads of recreational areas and classrooms, and then we also have access to the library and the gym and main campus, so it's nice to have two different places to bounce between.
Engagement with local communities throughout the course is one of the keys to developing professionalism and social accountability skills, plus a real understanding of the needs and demands of the different groups in the population. Students spend a considerable proportion of each year working closely with disadvantaged communities and other members of the wider healthcare team in their interprofessional engagement module.
The course does place a lot of emphasis on engaging with the community. Already in our first year, we have some community projects where we're going to be doing outreach. We're going to be doing some interviews and education for primary schools, secondary schools, smoking cessation, engaging with the traveler community. So I think it's really wonderful because these are actually the people that we're going to be treating day to day, and it's really important to know, the community you're working in and being part of, being an active member of your community.
RCSI's dentistry programme ensures that students are fully prepared for a primary care dentistry career. In addition, it provides students with foundations on which to develop both knowledge and skills, and provides the basis for future postgraduate and specialist dental training programmes for those who wish to pursue higher training.
Students benefit from small group teaching that promotes active learning and enables close interactions with lecturers. This approach ensures students receive regular feedback and tailored academic support throughout their studies.
Small group teaching has really helped me a lot, as I am more on the shy side as a person. Getting comfortable with a small group has been really easy for me.
It's easy in big lectures to sometimes get hidden and not really build a good relationship with your professors. But in a program like this, they've really focused on building a student and professor relationship.
From year one, students engage in supervised patient interactions, an essential feature that sets our dentistry course apart from others. This early clinical exposure helps students to build confidence in their skills from the start of their BDS journey. Students train in RCSI's simulated dental learning environment, a high-tech simulation space where they can safely develop and refine their clinical skills in a low-risk environment before treating patients in real-life settings.
Every week we get to do hands-on experience in the simulation lab, so it kind of shows you that you're not just studying, you know what you're working towards and where everything's tying in.
Our dentistry course is designed to equip students with the transferable skills needed for a lifelong career in dentistry. They receive comprehensive career guidance and support, helping to confidently choose their next steps after graduation.
We have a lot of different specialities here within the faculty, and so it's nice to know that if anyone does choose to pursue specializations, there's like a lot of support that's offered here.
Clinical education commences at the start of year one. Working in small, integrated groups, students learn the core scientific foundation of dentistry in a clinical context through an inquiry-based learning format.
I feel that I learn much better when I can collaborate with other students. We get to do that during our EBL sessions. We have like a group of 8 of us, and it's just a really supportive environment. You get to hear other people's takes on things as well.
From the semester 2 of year 1, the student experienced contact with the patients in the clinics, where they develop their clinical and communication skills under close supervision by primary dental care-based dentists. Towards the end of the year, the students have their first experience the community engagement.
I think because we're going to be doing this the rest of our lives, it's important to build that confidence early on. We're going to be looking at community patients early on in our first year, and these days are going to increase as we go along the years as well.
In year 3, there is a greater emphasis on the clinical practice and self-directed learning as the students then prepare a project assignment, including engagement projects with students from another healthcare professional and also clinical cases. Students also consolidate existing skills and undertake more advanced procedures under close supervision. One of the themes for year 3 and year 4 is to consolidate the learning of the medically related issues for the safe practice of dentistry. Students are given an opportunity to learn about dentally relevant medical issues in patient-based demonstrations.
In year 4, clinical activities will expand to approximately 3 days per week, and students start to prepare the clinical cases for finals.
I think there is a good balance between course theory and practical hands-on training. We do about 1 day a week of practical hands-on stuff, and then the rest of the days we're doing more theoretical learning, lectures, and workshops. But I think even the 1 day a week in the first year is more than most schools offer, and I know it's only going to go up from here. Like next year we're going to do 2 days a week, and we're going to do some days in clinic. So yeah, I definitely think it's a good balance. I think it's more than I could have hoped for.
Clinical dentistry will now embrace all aspects of dental care provision expected for a qualified primary care dentist. Students are also trained in advanced restorative techniques, strengthen their competence in treatment planning, and gain first-hand experience of the role and services provided by specialists in primary and secondary care. The emphasis in year 5 is on the implementation and consolidation of the skills and documents students have acquired in previous years, and in the final preparation for dental practice.
So after our 5 years here at RCSI, we're fully qualified certified dentists. I'll definitely want to specialize in the future, and I want to go into surgery. So we'll see how it goes, but so far it's been great.
Graduates of this program received the Bachelor of Dental Surgery degree from the National University of Ireland, awarded by RCSI. And international graduates of RCSI Dentistry program have a 1-year stayback visa option should they wish to practice dentistry in Ireland.